It's a really neat experience to be able to look into someone's eyes and kind of get clues as to their overall health. We can certainly see some of the earliest signs of diabetes, of high blood pressure, or cholesterol buildup.
Good vision impacts how we learn, work, and connect with the world. Yet we often take it for granted until something goes wrong. In this episode of Visionary Voices in Optometry, we're talking about why vision health matters and what you can do to protect it. I'm Mark Donison, and I'm joined by Dr. Virginia Donati, a practicing optometrist and valued OAO member. Let's dive into it. Hello, Dr. Donati. Thank you so much for joining us today. It's great to have you on the show. To start off, why don't you share with our listeners a little bit about yourself and what inspired you to become an optometrist?
I have been a practicing optometrist for 20 years this year. I have worked always in the same location with a few others here and there. I love what I do. I get something new and exciting out of it every day. My story of how I got into optometry is probably fairly similar to a lot of other optometrists in that we had a very close encounter with a pair of glasses at a young age that was very inspiring and really kind of was the launching point to what I wanted to do with my life.
And where did you go to school?
I went to school at the Pennsylvania College of Optometry in Philadelphia. Back in 2006 was when I left there and started practicing in Ontario. Been here ever since.
Excellent. Well, we're glad you're here. And thank you again for joining us today. Yeah. Vision Health Month is all about awareness and prevention. So from your perspective, why is it so important for people to prioritize their eye health?
Yeah, it is very important. And it's one of those things that can kind of get away from us. I think we tend to lose perspective and, pardon the pun, lose sight of the importance of getting regular eye examinations. The problem with having that get away from us is that we run the risk of there being some eye problems kind of brewing in the background that are pretty silent in the beginning and can be very problematic if left for too long.
And many people assume that if they see clearly, their eyes are healthy, right? So how accurate is that assumption?
Unfortunately, not very accurate. It would be great if we had that kind of self-measuring system, but unfortunately for people of all ages, including children, there can be pretty significant vision or eye health problems that don't necessarily trigger a drop in our eyesight.
And what are some of those conditions then that you see that patients might not be aware of that you would pick up when they visit you?
Yeah, starting with the pediatric population, we can have, more scary things like eye tumors, brain tumors, even things like amblyopia, which is a developmental disorder that can be present in children without them being aware. In older adults or in adults, we get things like glaucoma. We can have certainly changes related to the anatomy of the eye that can put us at risk for different problems. And then in our senior years, things like cataracts, macular degeneration, retinal tears and holes can happen at any age, particularly if there's trauma to the eye.
So lots of things could be going on without us really realizing it.
Unfortunately,
right.
Yes.
And so with that, then how often should people be getting their eyes checked? So there's a comprehensive eye exam that people should be doing. And does that vary by age or risk factors?
Yes, it does kind of vary with a lot of those factors. So we recommend that children get their eyes examined yearly, starting actually at 6 months of age. So the first eye exam recommended is at 6 months. And so not that we're asking infants which is better, 1 or 2, but there is a lot that we can get from a growth and development perspective that makes sure everything is on track. Once we kind of hit the 20-year-old and beyond, unless there are risk factors like, for example, contact sports, where there might be higher risk of trauma or concussion, that would make things maybe happen a little earlier or a little sooner. But frequently we kind of drop to 2 years, every 2 years at that point, and then bumping back up to once a year once we hit our senior years, over 65. But there are certain medical conditions, like if someone is diabetic, for example, or on certain medications where there's increased risk of eye health problems, those people, regardless of their age, should still be seen on an annual basis.
Right. So it varies depending on the life stage that someone's in and their health as well, right?
Yeah,
so
exactly.
It's not one step or one way for everybody then, right? So
correct.
Right.
The best person to tell you when or how frequent you should be getting your eyes examined is your optometrist.
Right. Perfect. And so for someone who hasn't had an eye exam in a while, What are some of the early signs or symptoms that shouldn't be ignored?
Well, certainly a drop in your visual acuity or how clear or how blurry you're seeing is a clue, but not the only clue. What we can see as well is things like flashing lights in the vision, floating spots in your vision that are different or unusual to you. Anytime we have a change in our medical status, so if there's a new diagnosis of something going on in your body, diabetes is a good example, that should trigger a cause to have an eye examination. Certainly, if there's any trauma to the eye or any trauma to the head, it can increase the risk of eye-related problems as well.
What about medications as well? Might that be something that people need to be aware of as their medications are changing, perhaps?
Yeah, absolutely. So certainly anytime a patient is medicated for diabetes, there can be a fluctuation in the eye health. Other medications that are used to treat things like breast cancer in women can cause changes or problems. Other medications that are used to treat certain rheumatological conditions, like rheumatoid arthritis, for example, there are some medications that can cause pretty significant changes to the eye health and really should be monitored on an ongoing basis.
Great. That's good to know. Mm-hmm. Can you talk about how eye exams can reveal other health issues? So what is it that you're actually seeing when you're looking into somebody's eyes?
Yeah, it's a really neat experience to be able to look into someone's eyes and kind of get clues as to their overall health. We can certainly see some of the earliest signs of diabetes, of high blood pressure or cholesterol buildup. We can also see, unfortunately, sometimes things like brain cancers or eye cancers. We can also see evidence of stroke in the vision sometimes. So there's a lot of different avenues or a lot of different clues. Even things like leukemia or anemia or other kind of blood conditions might show some clues in the retina as well. So when your optometrist is saying, bringing out the bottle of eye drops, although it might be a little bit of a cringe, it really does help us get the best view possible to the back of the eye so that we can make sure that we're seeing everything there is to see.
And that concept then is dilating their eyes, right? So when people go in to visit you, sometimes you'll take some time to dilate their eyes. And what does that actually do? And what's the point of doing that with the patients?
So we don't necessarily need to dilate the pupils at every visit in order to see the retina. We can do a lot of viewing of the retina without dilating the pupils, but it does give us the best view possible. What the drops do is they make the pupil wider, and that gives us the opportunity to see inside the eye, kind of like if we don't dilate the pupils, looking into a room through the keyhole versus actually open the door to look inside the room. So it gives us a much broader perspective of what's going on inside the eye. Right. And we can see the optic nerve, which is the connection point between the eye and the brain. We can see the macula, which is where our focal point of vision comes from, our sharpest acuity comes from. And then every part of the retina as well, looking at all the blood vessels, so little arteries and little veins that are in there, as well as looking for any problems in the retina itself, holes, tears, retinal detachments, that type of thing.
Technology as well in optometry is changing at lightning speed and has advanced significantly over the years. And so what types of equipment are commonly used today, and how do they help you assess the eye health more effectively?
Yeah, some of the equipment that we use hasn't changed in a very long time. If you think about some of the hand tools that your optometrist might use, for example, those have been largely the same for many, many years. But a lot of the imaging techniques that we have available to us now, things like measuring the depth of an eye to measure if a patient is progressing into their nearsightedness, or certain instruments like the OCT instrument or wide field imaging of the retina that gives us a view not only of the surface of the eye like a photograph might, but also going below the surface. So actually seeing into the tissue of the eye to give us much better perspective as to what's going on earlier and earlier.
And then lifestyle, as we were talking about before, also plays a big role in overall health. What are some of the everyday habits people can adopt to protect their vision?
Well, general everyday habits that protect your overall health are also going to protect your vision health. So maintaining a healthy, active lifestyle, a well-balanced diet are really good ways to start. But other things that you can do, for example, with keeping your eyes not dry, you can do things like making sure you're well hydrated, make sure that you have adequate humidity in your space, make sure that you're taking frequent breaks from things like devices, making sure that you're blinking often enough to keep the eyes moist as well as making sure that you're getting a lot of outside time, especially important for our children, to make sure that they are not, in the dark on a screen for many, many hours a day. That really is going to be helpful for their long-term visual health.
So in this world today, what impact does that have on our eyes? And then what can people do to reduce that digital strain that they're sort of exposed to now?
Yeah. It's a problem that's not going to go away. Our society has very much changed. And it, long gone are the days where I could shake my finger at a patient and say, ease up on the screen time. It's just not an option in a lot of cases. And the detriments or the effects of it are going to vary a lot depending on the age group of the patient. So if I speak to pediatric population, children really don't recognize when they have abused their eyes with screens. So whereas an adult might feel things like dryness or tension in the eyes or discomfort, telling them that they've been on the screen for too long, a child actually has to be on the screen for a lot longer before they start to experience those problems. So not that those problems are not occurring, just that they're not aware of it until much later on. So that can be harmful to the child where they're actually growing and calibrating their vision, and we are kind of training them to be close and training them to, stare and not blink as much. So that can have long-term effects. If I speak to the adult population, adults tend to be more sensitive to having excessive screen time. So they'll definitely tell us that they're uncomfortable. So making sure that the screen is an adequate distance away, that they do have adequate blink time, that they do have proper humidity in the space can certainly help as well to make sure the eyes are not getting too dry. There are supplementary eye drops that can be used for those, really long nights where you need to get something done and you don't have the opportunity to stop the screen earlier. But there are, other things such as taking frequent breaks, making sure you're able to disengage from the screen and look further away to give the eyes a chance to relax as well. That's really helpful.
With younger children then, if they're spending a lot of time on screens and they're very up close, what type of detrimental effect could that have on their vision over time?
Yeah, so what we're seeing more and more is that children are having a lot more problems with managing to use their eyes together. And so they can actually overstrain their eyes, so overfocus more than what they need to for the distance. And then when they're done and they disengage and they look up, it can take them a while to kind of reset their vision to look at distance again. So that dropping or jumping between distance and near can become slower, and they might actually complain to us that they have problems seeing in the distance when really it's just a slowing down of that system, for example. Right. It can also trigger long-term development of nearsightedness as a way to cope with how much strain is happening up close. And once that sets in, it's not really a bell that can be unrung. So once a child becomes nearsighted, they do tend to progress into nearsightedness. We do the best we can with a lot of myopia control mechanisms that your optometrist can certainly tell you about if you're you have a child who has nearsightedness. But really, the best treatment would be prevention. And to not have that happen in the first place.
Right. So for parents watching then, so what should they do about this, right? So to protect their kids' vision and their eye health?
Yeah. It's a great question, and it's one that I get a lot in the office. There's a certain amount of screen time that we're really not going to be able to police very much. So when we look at screen time and balance it between academic versus recreational screen time, academic, there's very little that can be done. Unfortunately, I have a lot of patients who are teachers, elementary and high school teachers, and they tell me that they have students who complete full essays on their phone because it's the only device that they have. So if you think about the small nature of that screen for the length of time, that can be certainly problematic, but not something that there's really a cure for or a treatment for. So what we can do is maybe balance the recreational time. If you're looking at a screen, is this an activity that you're doing that could perhaps be done on a much larger, much further screen, like a television, rather than on a small screen in front of you? If that option is there, choose that. Even at the very least, if you have a portable screen or a personal screen, like a phone or a tablet or a handheld video game system, can that be brought outside so that you're at the very least, you're in full light and daylight rather than inside in the dark? So at
minimum, it's sort of like mixing it up a little bit, right? So if
yes.
if you look at different different distances and different sizes screens and things
Yeah,
like that.
and break it up. I mean, ideally, we would have a minimum of a 10-minute break every 30 minutes. You've heard of the 20-20-20 rule, perhaps, which is taking a 20-second break to look at something 20 feet away every 20 minutes. It's a little inadequate this day and age, but it's at least a good place to start.
And I would imagine for a lot of kids as well, they don't really realize what's going on, right? They just, as they're growing, it's potentially seen as, well, it's just how my eyes are. It's just natural for them, right? And
yeah, and because children have such strong focusing systems, when kids are very little, they can see things very, very close up, whereas an adult would say, back up. So because children can abuse their system to a point where the average adult would be very uncomfortable, but a child doesn't recognize it until much later. So we need to police that on their behalf a little bit.
Interesting. The other part of overall health as well is about the mental well-being, and it's closely tied to overall health, right? And so how does vision impact a person's quality of life, and what support is available for those experiencing vision challenges?
It's a great question. And I tell all my patients, there's going to be a natural point in your life where your vision changes, and that happens to every human being on the planet. Typically, once your age has a 4 in front of it, we start to lose the ability to focus up close. And that's something that can happen a little earlier or a little later, depending on the person and depending on, what your natural prescription or natural visual acuity is. But everyone starts to lose the ability to focus up close, and it can be quite alarming. It can be quite frightening. It can be quite frustrating when all of a sudden the things that you used to do with no problem, all of a sudden you're struggling to do. And then people like us say, well, you need to wear glasses, or you need to wear contact lenses, or other surgical type options. But it can be a very big pill to swallow, or a difficult pill to swallow. So, being aware that this is a natural change that's going to occur and what the options are, your optometrist can certainly discuss with you all the different possibilities for treatment that there are for those types of things, and giving yourself some grace. So yes, it might be that your eyes are not able to do what they used to when we were 20, but it doesn't mean that we can't live very fulfilling, lives with the vision that we have. For those patients that are experiencing more significant visual loss, things like glaucoma, macular degeneration, or other retinal diseases that can cause slow, progressive, degenerative visual loss, those can be, extremely difficult for patients to adapt to. When you've seen a certain way for, the length of your life, and all of a sudden that's slowly being taken from you, it can be very challenging to kind of rise above that and see what the possibilities are beyond that vision loss. But there are a lot of different programs and resources available that your optometrist can help you navigate the remaining vision that you have.
Beyond the support that you provide, right? How much are you aware of other support mechanisms in place to help with people when they're particularly further down the path of losing their vision?
Yeah. So for those patients that are suffering from more significant visual loss, if it gets to the point, typically people will report the greatest loss of independence when it starts to affect their independence for driving. So when people lose their driver's license because of a loss of visual field or a loss of visual acuity, that's when we kind of hear from our patients that they're the most impacted. Certainly there are, ride share type options and things available, but beyond that, there are things that you can arrange through your community, different rides that are available, or different mobility options that are available to help. And those would be very community specific. Now, if we're talking about things like being able to perform at a job or enjoying your hobbies still with the loss of visual acuity that you have, there are a lot of low vision optometrists that kind of specialize in that area of care that can use different assistive devices, magnification, and lit type options that will give the patients the most independence possible with the remaining vision that they have.
So lots of support mechanisms available.
Absolutely.
For sure. Now back to the earlier part of your answer. So when people are going into their 40s and they sense all of a sudden like, whoa, I can't quite see as well as I used to, that's a very normal, normal or relatively common event. For
Common,
people,
normal,
unfortunately, right?
all of the above, yes. What I tell my patients, it's kind of the gray hair of eyeballs. It happens to everybody, just depends on when. A lot of that's going to be, kind of what you do with your eyes and what prescription you had prior to,
Right.
hitting the big 4-0. But it does happen to everybody. It's
Right.
the warranty's up, unfortunately.
So, and the pace would vary then? Some people
Yes.
would have very, right. And so, so on top of your knees giving out and your back giving out, your eyes are giving out at the same time, right? So perfect. Thank you. That's very
Sorry.
encouraging. And sort of building on that then though, for those who may be feeling anxious about visiting an optometrist, what would you say to encourage them to take that important step?
Yeah, I think that varies by age of the patient as well. A lot of times we'll get children in the practice who are scared because they've, perhaps never experienced it before, or they have apprehension about what's going to happen. So for that, I would say, we have a lot of experience with children who are frightened, and rest assured that there's no needles. So nothing is going to be, drastically uncomfortable for them. We look at a lot of pictures, we look at lights, so that it should be a pretty calming experience for the most part, or at least calm experience for the most part. For adults who are more anxious with the experience, my best advice would be the first step is booking the appointment. So if it's the apprehension or the fear or the anxiety of the experience that's preventing you from receiving eye care, really take that jump, take that leap and book the appointment. When you get in there, be honest with the optometrist and say, I have put this off, or I have had concerns. I'm worried about, fill in the blank. And they'll absolutely do their best to work with you and make sure that every step along the way, you understand what's going on and the necessity behind the test that we're doing. And again, no needles.
Right.
So that's the best part.
No needles. There is a puff in the eye though. Sometimes,
well, yeah,
right?
sometimes,
Yeah.
but it's just air. Just
Right.
go to your happy place for a minute. Yeah.
Dr. Donati, thank you very much for joining us today. If there's one message you'd like viewers to take away during Vision Health Month, what would that be?
Get your eyes checked, regardless of your age, whether you have a 6-month-old child, whether you are in university and super busy, or whether you are chauffeuring your children all over the place, or whether you've retired and have more time on your hands. There's no greater gift you can give your future than to get your eye health under control and managed long term.
Hope to see you back here on another episode at some point.
Absolutely.
So thank you so much.
Thank you.
Vision Health Month is a reminder that taking care of your eyes is essential to your overall health. If you haven't had an eye exam recently, this is your reminder, because your vision matters and so does your long-term eye health. Thank you for joining us. If you enjoyed this episode, hit the like button, subscribe, share the link with your friends, and stay tuned for another Visionary Voices in Optometry. See you in the next episode.